My name is Dr. Charles Shepherd. I'm medical advisor to the ME Association, which is a self-help support charity for people with ME/CFS. ME/CFS, it's an illness which normally starts suddenly, acutely. It often follows an infection, which may be a fairly trivial infection, and it tends to affect people in their 20s, 30s, 40s, although children can be affected, as can more elderly people. I first got involved with ME/CFS after catching it myself. I was working as a hospital doctor at the time when my patients had shingles, and I caught a very nasty dose of chickenpox from it, and that's what triggered my ME/CFS off in the first place. I think a lot of people don't realise that it's a very debilitating illness to have. It involves a combination of symptoms, but in particular muscle symptoms, exercise-induced muscle fatigue and quite often pain, brain symptoms, problems with memory, concentration, attention span, problems with balance, not being able to stand up properly, and also just not feeling well, continuing to feel flu-like. You put them all together and it's an illness which is going to affect every aspect of what you try and do. It's an illness which can, in most cases, be diagnosed by your general practitioner, but he can't do it in a simple appointment, so you probably need to ask for a double appointment if you're querying this diagnosis. Your GP really should take a detailed history to make sure he's not missing any other causes of an ME/CFS-like illness, because there are a lot of different illnesses that can present with these sort of symptoms. So after taking a detailed history, your GP will also want to do a range of investigations to rule out things like kidney disease, thyroid disease and other illnesses which can cause ME/CFS-like symptoms. If he's not sure, then your GP can refer you to a hospital specialist for a more accurate diagnosis. I think there are 5 key aspects of management of this illness. First of all is getting activity management correct, getting the correct balance between activity and rest. Secondly is the use of drugs, which can be helpful for treating things like pain and sleep disturbance, although we don't have a drug which is going to cure this disease. Thirdly is sensible use of alternative and complementary therapies. Fourthly is dealing with work and education where that's relevant. And fifthly is dealing with emotional, psychological problems if they arise. Unfortunately, at the moment, we don't have a drug treatment that will cure ME/CFS or effectively treat it. And this means that the outlook is quite often rather unpredictable. But we do know that people tend to fall into one of 3 broad groups. First of all are those who make slow but steady improvement. Secondly is a group in the middle who tend to follow a rather sort of up and down, rather erratic course, but they eventually stabilise and follow this pattern. But thirdly, there are a small, perhaps 20–25% of people with this illness who fall into a severe category, who remain housebound, bedbound, even wheelchair-bound with this illness. The good news for children and adolescents who have this illness is that on the whole, their outlook is far better than adults who have this illness, and a lot of them do return to full normal health. This is an illness that affects all parts of the person's life, not just the medical aspects. It affects their family, their relationships, their finances, what they do in relation to work, school, social activities, etc. And all these things are going to be affected by having ME/CFS, and they're likely to be affected for some time. So this is something that people have to come to terms with and get whatever help in the various different areas that they feel is going to make them, improve from those points of view.